Welcome back to Museum Dental Insurance Information Session. My name is Maria Correa and I am Director of Operations and Patient Advocacy at Museum Dental. My area of expertise is in the insurance coverage, treatment planning to maximize your insurance coverage. So today's topic, if you haven't followed us before, every month or so we try to give you a little bit of insurance information in order for you to be able to better understand your dental benefits. So today's topic is on implant coverage. I'd like to cover this and try to explain to you. It is a little bit complex, so I'm going to try to explain it to you in layman's terms to the best of my ability. But if you have any questions, please feel free to contact me afterwards. So how many of you have actually decided that yes, you've been told you need an implant and you should get the implant? However, upon checking onto your dental insurance coverage, you find out that you actually don't have any insurance coverage for implants. You turn around and you ask the dentist for another option, and he gives you the option of getting a bridge in that area as the alternative instead of the implant. And many of you, because you check into your insurance companies, you turn around and you find out you have insurance coverage for a bridge. So you opt out of the implant, even though it probably was the best treatment plan for you, and you go for the bridge. Well, in many cases, you do not have to do this, and let me try to explain why. Many insurance companies, although they do not broadcast it and they do not put it in your insurance booklets, they have what is considered and known in the insurance industry as alternative benefit coverage. Let me try to explain what that means. So let's say that you need a crown on your front tooth. However, you do not have coverage for that implant crown. So if you were to get the implant, you would actually get back from your insurance company towards that implant zero coverage. But you go ahead and you get the alternative, which is the bridge. And in many cases, the bridge is covered. So what they'll do as the alternative benefit coverage is that they will actually reimburse to you what they would reimburse to you should you have decided to go with the bridge. Keeping in mind that no insurance company has the right to dictate to you the actual treatment of choice based on your coverage. Therefore, I always advise patients that you should make your decision based on the best treatment possible for you and not based on your coverage from your insurance company. In many cases, patients are not aware that they have alternative benefit coverage, and therefore they go and they opt out for option B, which is not necessarily the most favorable option of treatment, but they do so based on the coverage that they would have through their insurance. So I strongly advise you that if you're having any major work done, especially when it comes to implants, that you get all the details of your benefit coverage and you look into whether or not you have alternative benefit coverage. Alternative benefit coverage will reimburse you the cost of what you would still have done as an alternative treatment in that area instead of the implant. However, you can go ahead and get the implant and they will give you the money towards that treatment of choice. Again, remember, you should not be dictated by your insurance as far as when it comes to your dental treatment. You should base that on a needs basis rather than your insurance coverage. And again, you should also check into whether or not you have the alternative benefit. Contact your dental administrator. Find out from them if they know anything about the alternative benefit exclusion in your benefits package. And find out whether or not there is implant coverage. Does it pay it out at implant strictly, or does it pay it out as an alternative? It's completely different. So you want to make sure that you have complete clarification on this issue before proceeding. Okay, so again, if you have any questions or concerns, please email me, maria@museumdental.ca, or you can follow us, please feel free to follow us on blog,